All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So first, a quick update about my colleague. She's doing much better. So yesterday I came back because she was able to, number one, start moving around in the house. And number two, she had some caretakers that were lined up as well. So I am pretty happy with the outcome. I sent her a message today and asked her how she was doing. And she responded with, she said, I'm a bit better today and you're a lifesaver. So she actually is doing better. So that is good. The other thing that I wanted to discuss is this talk we've been thinking about for some days is the Japanese study that shows that, or supposedly shows that spike proteins will be in various organs, including ovaries. And someone, one of the cool beans who I don't want to name them, here is what they sent to me a few days ago. This is actually not just a few days ago, June 1. Please listen to this. So this is Dr. Byram Bridle, Professor of Viral Immunology, University of Guelph, I think from Canada. Please listen to this. Evidence from Japanese study shows that the spike proteins gets into the circulation. One of the reasons why we are seeing heart problems, clotting, and getting into the brain. And then he sent me, here is a translated copy of the Japanese study. So I actually watched that talk with Alex. In there, he did talk about Japanese study, and he said we are asking for more information. I do not know it was exactly this study or he knows something else. If it was this study, then he is quite wrong. And if it is something else he's referring to, then I do not know what he is talking about. I have to look at that study. So let's start looking at this Japanese study that shows the absolutely. So Genesis Lights, you are absolutely correct. So Japanese study shows the lipid particle, not the spike protein. Absolutely. So let's now look at the study itself. I'm going to share my screen and go over it. So we'll start with, this is the artwork I did yesterday. So after coming back from Oregon, I woke up early at night. And so I sat down and I did this painting. So this painting's, the title is Trip to Oregon, because what I did was I took one of the pictures that I took on the way and just painted a part of it. Now, let's look at the study itself. So here is drbeen.com. This is the Japanese Pfizer. I do not think it is really a study. It is a study. It is a biodistribution analysis, and that is the study. And we would look at that. This is the Japanese, what is that? The Japanese version. I have the translated version that Ray sent to me. Now, how good is the translation? That is going to be the weak point here as well, because I am going to present as well as the translation. And then if there is any further mistakes, that these are mine. So continuing on, this is the study. There are some articles about it. For example, here is an article. I do not know how good or bad this site is. Whatdotheyknow.com. Looks like a little, on the negative side. But let's see. This Japanese data shows that the spike protein of the Pfizer vaccine gets into the blood, where it circulates for several days post-vaccination and then accumulated in organs and tissues, including the spleen, bone marrow, the liver, adrenal glands, and in the ovaries. So this whole statement, whole paragraph is incorrect. And I would go over the study. Then here is TrialSite News, which is kind of one of the news site where FLCCC and Steve Kirsch and many other folks kind of, including us, go there as well. So we like this site. However, even they had, so look at this. According to the documents, preclinical studies show that the active part of the vaccine, messenger RNA lipid nanoparticles, which produce a spike protein, spread throughout the body and is then concentrated in various organs, including the ovaries and spleen. So this is a very interesting way of articulating it. Ideally, they should have simply said it's really a part of the lipid nanoparticle that goes into the organs. Instead, they kind of wrapped it in a way that it stays interesting for the reader and not super clear. Why did they do it? That's what they know. Then similarly, over here, they say among the most critical tests which must be performed prior to the testing any drug or vaccine is in a human being is whether it can cause mutations in the DNA, genotoxicity, or whether it could cause problems with cells or tissues of the reproductive tract, including ovaries. So they kind of create a concern, and fair enough, they're talking about probably Pfizer did not do correct testing. But in that, here, check this out. But these new findings suggest that the routine quality testing issues were overlooked in the rush to authorize the use. People are now receiving injections with a messenger RNA gene therapy based vaccine, which this is really not a gene therapy, which produces the SARS-CoV-2 spike proteins in their cells, and the vaccine may be also delivering the messenger RNA and producing spike. So see the word maybe. So if somebody would challenge it, they would say, well, we said maybe, we're not sure. Maybe also delivering the messenger RNA and producing spike proteins in unintended organs and tissues, which may include ovaries. Unfortunately, there is no way to know if this is related to vaccine safety signals or report of menstrual irregularities. The required studies were either not done or not done properly. So once again, if we do not have the data and the data is improper, then why to just connect it? But if we do connect it, may or may not that can be inserted everywhere. And similarly, if you see here, however, any cell that has spike protein or protein fragments anchored on its membrane or displayed on MHC antigen presenting molecules, and then they continue, if this actually happens, the resulting vaccine reactogenicity could resemble clinical symptoms of autoimmune symptoms. So all those negative words that scare us, including me, so they scare me too. So I'm not saying they do not. They're all in this one article, but all of them have this escape from the responsibility or from an absolute term by saying, if this actually happens, if this may happen, but all of those are there. And this is actually a good site. So anyways, this is TrialSite. Here is a study not related to the discussion that we are going to do directly, but still an interesting study to look at it from Pfizer, that they saw that with the Pfizer, not Pfizer, from Israel, and this study shows that when the vaccine is given, there is actually no change in ovarian function or reproductive hormonal functions and so on. So if you see here, results, both natural and vaccine elicited anti-COVID antibodies were detected in the follicular fluid in levels proportional to the IgG serum concentration. Follicular fluid is the fluids that are in the ova when the ova is maturing in ovary. No differences were detected in any of the surrogate ovarian follicle quality reporting parameters. So just an interesting thing to read. And this is an article about it. Then in today's discussion, we are going to talk about the liver's role in nanoparticle destruction. And here are some of the functions of the liver. And once again, if you do not like Wikipedia, you can just take this topic name and search it and read it wherever you like. In addition to this, one last reference. This is my video. I talked about this topic on 18 May 2020, last year's May. So more than 12 months now, in which, if you see this diagram, this was the lipid nanoparticle, and here the accumulation in the liver. So I had discussed at that time that there is a concern to understand that the nanoparticle, the lipids from the nanoparticle, where are they going to end up? Are they going to go and accumulate in the liver and be there forever and maybe damage the liver? So now we have the answers to those things. So today's study is actually really, really exciting for me. I actually became very happy when I looked at it because it answered some of my questions. And no, I was not as concerned as many in the articles have been. So now let's look at it. So here is a study, and now I'm going to just quickly illustrate it, and then we'll look at the study pieces as well. So we'll start from here. So these are the gifts for biodistributing humans. Uh, what is it that they are trying to understand with this study? If you go back here to the study itself, what they're doing is they're trying to figure out the pharmacokinetics of the drug being the lipid nanoparticle. So the basic question that they're answering, and I'll give you the summary now and then we'll go over the rest of the data. The basic question that they're answering is, or asking, is that what happens to the lipids from the lipid nanoparticle, the nanoparticle that contains the messenger RNA and is injected in us, what will be the fate of the parts of that particle? That is the basic study here. And in here, they are looking at multiple parts of the lipid nanoparticle. For example, there is a part which is the aminolipid. Aminolipid mean the lipids or the fats connected with amino acids. Amino acids make protein. So you can say protein and fat combination, which is called ALC0315. Then there is polyethylene glycol that we have been talking about for a long time, that is called ALC0159. These are the two important ones that they wanted to understand. Where do these pieces of fats go? Not the spikes, not the messenger RNA. Where do these pieces of fats, how are they destroyed? Where do they end up? How much they circulate and so on? Then they said that the lipid nanoparticle is formed by this thing. We'll talk about it. Then they said we are looking at this. So I'm going to stop here for a second, especially this part here, and I'm going to go here. So let's say this is a lipid nanoparticle. What they're saying is this lipid nanoparticle is made up of many components. One inside it is the messenger RNA itself. This nanoparticle is a vehicle to take the messenger RNA, go into the cell, allow the messenger RNA to then work with ribosome and create the spike proteins. So the question is, this vehicle, what happens to this? This particle, what happens to this? So imagine that this is the lipid nanoparticle, and this particle has multiple pieces to it. One of those, and this is not the actual structure, I just made those as illustrations or representations. So there is ALC0315, which is an aminolipid. Then we have ALC0159, which is the polyethylene glycol. Ideally, it should be like this here, but anyways, I made it as a piece. This piece, and then there are more things, and inside it is messenger RNA. How do they make it? This again, if you look at here, they're talking about this part by mixing DSPC and cholesterol. So what they do is they mix DSPC and cholesterol, and that makes the lipid nanoparticle, which has these further structures. Now, what did they want to test? So look at this. If we can just go through these 2-3 lines, the whole thing becomes clear, and we become clear as what are they talking about and what are the people talking about. Here is what they're saying. They're saying BNT162b2, the BioNTech vaccine, is degraded, is broken down by ribonucleases. So this is the messenger RNA we're talking about, is degraded by ribonucleases in captured cells and nucleic acids. So this is a translation from Japanese, so it is not exactly the right translation. So it is more literal. So some words would come here and there, so out of order. So ideally, what they are saying is that the nucleic acids of BNT162b2 or the RNA is degraded by ribonucleases. Ribonucleases are RNases, and we have talked about RNases for a long time. RNases inside the cell will break down the messenger RNA when that messenger RNA has been used up, has been functional and gone, or needs to be broken down. So then check this out. Then they're saying, and the translation just put thank you over there. So I do not know what was that expression, but S protein derived from BNT162b2, derived from that, not derived, but I would translate it as manufactured from that messenger RNA, is expected to be subject to proteolysis. S protein is subject to proteolysis from the above. So from these 2 points, what are the 2 points? One point that the RNA itself would be broken down by the ribonucleases inside the cell, and the S protein will be broken down by proteolysis. Proteolysis enzyme or proteolytic enzymes are usually present inside the cell. We know them in our discussions as lysosomes, or these lysosomal vacuoles have the digestive enzymes. We also know them from endosomes, and we know them from the idea of the proteins breaking down in endosomes. So that is proteolysis. If a protein escapes and goes out, there are proteolytic enzymes sitting outside the cells as well. There are phagocytic cells like macrophages and dendritic cells as well, which can pick up the proteins too. However, they just went this much, and then look what are they saying. From the above, these 2 points, it was thought, and they may be wrong, it was thought that no need to evaluate metabolism and excretion of these components. What are these 2 components? The messenger RNA and spike. So what are they saying? They're saying, because we know that messenger RNA will be destroyed inside the cell by ribonucleases, because we know that the spike proteins will be broken down by proteolysis, I would have added a couple of things here as well to say phagocytosis would occur and all that. They said that was not our intent to figure out what is happening there. We wanted to understand what happens to the rest of the lipid nanoparticle. What happened to the lipids? So the objection one can have here is this: hey, why did you not look at spike proteins? That is a fair objection. Or why didn't you wait for the messenger RNA and look at it? That is a fair question too. But this study cannot be used by anyone. If Dr. Brian Bridle used it, then he used it incorrectly, or if maybe he used something else, because I did not hear from his mouth that he was referring to this study. If he was using something else, then we do not know. Similarly, if anyone else is using this study to say that in the ovaries will be the spike protein, they are wrong. So continuing, then they talk about, we wanted to understand what would happen to the lipid particle, and not only that, they wanted to understand what would happen intramuscularly or intravenously. So they tested it by putting this component in the muscles of the rats or injecting in their veins. And they wanted to understand in both cases, those particle pieces, what happens to them? How are we breaking them? How are we clearing our body of them? This is a very standard thing to do with all drugs or other things that we try to figure out what happens to their biodistribution, then what happens to their kinetics, what happens to their dynamics, and part of the kinetics is how are they eliminated, where do they go in the body, and that's fine. This is the basic discussion. So if just these three lines are understood, there will be no one who will be confused about this study. So now let's look at what they are doing. So they said we want to understand what would happen to these broken pieces. So when would these pieces be created? Remember that the lipid nanoparticle will come around. So let's say this is the particle, and here is a cell. The particle would fuse and get into the cell because it is a lipid. Inside the cell, it would break down into the components like ALC03, what is the name here, 0135 or 159. These things can diffuse out. Why can these diffuse out? Because they're lipids. Lipids can fuse with the cell membrane and come out. Cholesterol pieces can do that, but usually lipids are not moving about that way. But anyways, there are lipids that are here that can get out, or these lipids can be picked up here, or these lipids maybe can go out into the blood vessel as well with the messenger RNA. But in their discussion, they are talking about just the pieces of the lipids. These lipids. Now, messenger RNA is here. It is going to take part in making the spike protein. They're talking about the remaining pieces and say, where would they go? What are they going to do? What was not tested? They were not testing the spike protein. And why were they not testing for the spike protein? Because this is Pfizer or Pfizer team or their funded team who's working on it. They're saying that the messenger RNA is degraded in captured cells, and the spike protein is expected to be broken down by proteolysis. Okay, so page number 3, I just showed it to you. They are saying that, hey, this is a messenger RNA. It would be broken down by the ribonucleases. Ribonucleases are present inside the cell and they're present outside the cell. This little embarrassed monster who has chewed up this whole RNA. Ribonucleases are present inside and outside the cell. Again, this is normal information. If we go here and say ribonucleases outside the cell, you would see that in the interstitial fluids as well, the ribonucleases are present. Inside the cell, of course, they are present. So here is a ribonuclease that would break down the messenger RNA. The spike proteins that are made. Again, I'll continue to refer back to this document, so I am not saying something here. S protein derived from BNT is expected to be subject to proteolysis. So here is a proteolysis or proteasome or endosome or a vacuole of proteasome which has the proteolytic enzymes in it. These enzymes are also present inside the cell. They're present outside the cell as well. But we are generally very careful about these enzymes to keep them trapped in the vacuoles, because once they are running around free, they can break down other proteins as well that are of our need. So usually we keep them inside the cell, and we keep them in small vacuoles, which are called endosomes, or they are also called lysosomes. Lysosomes, in which proteolytic enzymes can be found. So once again, when they say that the proteolytic enzymes are going to break down the spike protein, majority of the time they're talking about this thing present inside the cell and breaking it down over there. Now, what did they then test? They took these parts, lipid parts, in vitro and in vivo, and the in vivo was in mice, not in humans. What they did was they tested in vitro, that means in petri dishes, and then in vivo they did intravascular testing, I'm saying intravascular, intravenous testing and intramuscular testing. And what did they find? That is really interesting. So the question that I asked in May 2020, last year, May, what will happen to lipid nanoparticle? How will we kick it out of our body? Will it ever get out, or would it accumulate somewhere in our body and be there forever? The problem with that is that maybe one-time vaccine, a tiny piece, it doesn't even matter. But what if children are getting vaccines, or what if we now need to have boosters? Would this be a problem? So that is answered here in this one. This is a beautiful study. So here is what they said. If you give intravenous parts of the lipid nanoparticle, so you inject them in the blood vessel, then 0315, 1% of that is directly excreted, 1% only is directly excreted unchanged in the fecal matter. And I would explain why do they talk about that in this way. And almost nothing in urine. So 1% unchanged directly ends up in the fecal matter. How? From the liver, it would enter the bile, and from the bile route, it would enter the GIT, and from the GIT, it is 1%. The 0159 polyethylene glycol, 50% of that, without any further metabolism, without any further breakdowns, that would get into the liver, from the liver into the GIT, and 50% removed through the fecal matter and not urine. Why do I say not urine? Liver can actually change things, substances, drugs, food, particles, in a way that they can be excreted through urine as well. So they were trying to figure out what is the pharmacokinetics, where are these things going? So first thing that they found out was that half of the polyethylene glycol is just going to get out through the fecal matter. 1% of 0315 is going to get out through the fecal matter. Now what happens to the remaining half? And what happens to the remaining 99%? That is what they found out, that when you inject them intramuscularly or intravenous, they both had different mechanisms. If you inject them intravenously, directly in the blood vessel, so again, we're talking about the particles, pieces, we're not talking about messenger RNAs or spikes being formed. These pieces, they say if you send it in a blood vessel, then these are distributed more in the tissues, which makes sense. If you put something in the blood vessel, that thing is going to circulate in the whole body and get out wherever it can. So where did it get out? So first thing, when it encountered the liver, within 6 hours to 2 days, if it was intramuscular, so please switch for a second to intramuscular. If it was intramuscular, within 2 days, liver cleared it out. If it was intravenous, then because it would go and sit down in various tissues, it would take up to 9 days to be removed. But it will be removed in both cases. What is the route of removal? Does it go out through urine? Many drugs are metabolized by liver in a way that primarily they are excreted in urine. Or does it go out in fecal, or is there an equal or combination of these? And they found out that primary route of the elimination of the fats in the nanoparticle is fecal route, which is once again excellent. So liver would break it down and throw it out within 2 days to 9 days, depending upon. So these vaccines are not given intravenously. If these were given intravenously, they'll be ejected from the system in 9 days. They're given intramuscularly, and then whatever out of the muscle goes, those pieces in the liver and other places, 2 days, and they are eliminated. Now, how is their concentration? Again, this is not the concentration of messenger RNA. This is not the concentration of spike protein, because they're not supposed to be running around in the body. The pieces, the lipid pieces, are going to be outside. So what did they find? When they did intramuscular test, which is a more closer test to what happens to us maybe, compared to intravenous, they found that at the site of injection, 80% of the product is taken care of at the site of injection up to 90 days. So if I got the vaccine Pfizer today, 80% of the vaccine would stay in the muscular area for 9 days and then be eliminated. The remaining 20% of the vaccine's particles, not messenger RNA, not spike protein, would be distributed in the following way. 18% will go to liver and be eliminated by the liver. It's actually a good thing. It's not a bad thing. There's nothing wrong here. It's actually a good thing. 1% goes to spleen. So if you say, why would it go to spleen? Well, when these pieces would end up in the bloodstream, we're talking about the pieces of the fats, not spike protein, not messenger RNA. They are going to accumulate in various parts of the system as well. Spleen is on the route in the circulation. So 1% goes in the spleen, 1%. Adrenal glands, 0.1%. So 0.1%. Ovary, 0.01, 100%. And not the spike protein, not the messenger RNA, the pieces. What are the pieces? 135 and the 519 or 159. Where is it written? Page number 6. Let me very quickly show you. Look, the RNA, again, this is a translation, so it's all over the place, but one can make sense of it. I had to ponder over this again and again because of the translation issues. The RNA encapsulated lipid nanoparticle is intramuscularly administered at a dose of 50 microgram RNA and 15 minutes after. And so they're explaining what is going on. And here, total radiation recovery. So they had tagged it with radiating material, luciferase. So the total radiation recovery rate for doses other than the site of administration is, and here, this is actually 18% written here, liver 18%, spleen 1%, adrenal 0.11, ovary 0.095, or let's say 0.01, let's say 0.1 even, tenth of a 1%. Significantly lower than the liver. So that means when the Pfizer vaccine is given, messenger RNA and the spike protein is taken care of in here. 80% of the remaining lipid particles are also destroyed in the intramuscular area within up to 9 days. 20% would get out. The whole particle would not get out. Broken pieces of the particle would get out. 18% would be taken care of by the liver. Very good. That is what we expected. Liver is not accumulating them, it is actually breaking them and throwing them out. Excellent. Love it. And then the remaining tiny amounts here and there. Now, exactly where, other than, I mean, everybody just picked up ovary and started scaring everyone. That is actually not even significant. But anyways, we talked about ovaries. I want to show you this table here. First, let's look at this diagram. This is a diagram of how the liver would conjugate, or actually not conjugate, hydrolyze. In the liver, when we are detoxifying something, when we are modifying some substance, we can activate that substance by modifying it. We can deactivate that substance by modifying it. Activating a substance may even make it a poison. Usually the activation of a substance is beneficial for us. Here they're showing the activation of ALC0315, which is a small aminolipid piece of the lipid nanoparticle. And they are saying that two hydrolysis occur. You add water, in layman terms, we add water to that twice, and now it becomes excretable. So this is that over here. So if you see here, these are hydrolysis that are occurring. Then so if you see ALC0315 is metabolized by receiving ester hydrolysis twice in succession. And then they talk about 159, and how is that eliminated by the liver? It is hydrolyzed of amide bonds. So the amide bonds are broken down by hydrolysis. So that is how it is done. And now I want to show you a table. So if we go down here, there is a table for where these pieces of lipids were found. So here, check this out. And this is 0.25 hours after the administration. And they would have said over here that was it intravenous or intramuscular. They tested both ways. They tested if the vaccine is, or the pieces are given directly in the blood, what would happen? And they tested it if it is given in the muscle, what would happen? So here, if you see 0.25 hour, 1 hour, 2 hour, and so on, where did they find these things? Adipose tissue. That means it went to fat. Look, this is circulating in the whole body. So it can actually go into various pieces and then cleared out. Adipose tissue, adrenal gland, bone, femur, bone marrow, femur, brain, eyes, heart, 0.04 in brain as well. And if you see here, it keeps going at after 48 hours, it is 0.06. So almost more concentration increased. Injection site, 128. So majority at the injection site. Kidneys, and then if you look at it, 128 at the injection site, it kept accumulating there, 165 and so on. Large intestine, liver, lung, and if you keep going, muscles, ovaries. So this is what people picked up and kind of kept becoming concerned about, and that's fine. Concerns are okay, but representation as accurate as we humanly can. I make mistakes when I represent things. That is on me. But misrepresent sometimes it seems like deliberate. Anyways, pituitary gland, prostate, salivary glands, and so on. So they have actually talked more than just the ovary or other places. Here, if you see administered dose, male and female combined, and the dynamics are there. So they've given the dose dynamics. They have given the various hour and how it changes. They have given in various sexes and in various half-lives how it works. So this is the basic study. So let me just finalize it over here. This is it. So I'm gonna stop and see if there is any question. Otherwise, we'll do a quick chit chat as well. Okay, excellent. So do me a favor, if you can, please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description as well to support this work. In addition to that, I started a subreddit today. On that subreddit, we would start prioritizing the topics for the coming days. So may those be here. So Tom says, show the numbers for ovaries. So let's do that. So overall, 0.09, let's say 0.01. 0.01, isn't that 100th of a percent? Right? 0. But if it is 10, then that would become 0.1. So 10th of a percent, almost 10th of a percent. So if I go here to their document, here. So they start from here, and I think this is alphabetically written, and you can see various numbers. The muscle itself, or the site of injection, is going to be somewhere over here. Well, it says 128. And ovary is here, 0.1 is in the ovary. Where was 128? Here, injection site 128, kidney 0.3, liver 0.7, lung 0.4, and so on. But once again, is this actually harmful? No. And do you know why not? Again, there are some people who are allergic to polyethylene glycol. They develop an immediate reaction to that. So that, is it polyethylene glycol or other components? Is it 135? We had done a discussion of a study where we discussed that the immunologists were trying to check for polyethylene glycol in the people who had gotten reaction to Moderna, and they could not elicit an allergic reaction test to be positive with polyethylene glycol. But when they gave the whole Moderna vaccine in a small dose, that created a reaction. So there is something in there, both Pfizer, Moderna, that causes allergic reaction. What is that? Is that PEG or is that something else? I don't know. And I think it is not known yet. So they could be allergic to some people, and that would cause allergies. Other than that, these are nanoparticles that are cleared anywhere from 2 days to 9 days, or pieces of nanoparticles. So with this, I'm going to stop here, and we would do a quick chit chat in a second. So Terj says, messenger RNA vaccines make body to make antigens. Can't this confuse immune system? They need to attack some self-created. Okay, so how about Terj, we answer this question in the next talk, just so that this can stay a smaller chat. So I'm going to stop now, and I'll come back again, and we'll answer questions related to this study.